دكتور حط ميوت.
We have regarding to the vertebral column, we have 33 vertebrae. These vertebrae will divide it into 7 cervical, 12 thoracic, 5 lumbar, 5 sacral which are fused, and hoxy 3 fused also. The vertebrae, not all the vertebra or the vertebrae are the same. Each part of the vertebra regarding to the cervical have a specific feature, and also in thoracic and also in lumbar and so on. So we have to identify how to differentiate the vertebra from each other. This is the structure of the vertebra, which is the general vertebra. All the vertebra have its specific feature like that. So what is the specific feature of the vertebra? The vertebra is formed from body and the 7 process. This is the body of the vertebra. And from the body, 7 processes arise, like transverse process here and the transverse process, like spine in the middle, superior articular and inferior articular process. Superior articular, we have 2 superior articular and we have 2 inferior articular process. And the spine is formed by the union of the 2 lamina, lamina and the lamina. And all these process connecting or attached to the body, but what means by a pedicle. So this is the general features of the vertebra. This is the general feature of the vertebra. The cervical vertebra, we have 7 cervical vertebrae from C1 to C7. Okay, I wanted to identify the vertebra from each other. Why this vertebra is cervical and why this vertebra is thoracic. So we want or we have to identify the vertebra from each other. The most characteristic feature of the cervical vertebra, for example, here you can identify this is the body. This is the body of the vertebra. Number 1, you have to look to the transverse process. We have here transverse process and the transverse process. This is the lamina, and this is the lamina, and unite together to form the spine. Please, the first step, look to the transverse process. This is the transverse process. If you find inside the transverse process a foramen like that, one foramen here and one foramen here, so this vertebra, number 1, is cervical vertebra. If no foramen here, this is maybe thoracic or lumbar. Number 1, look to the transverse process to identify the foramen in the transverse process. If this foramen is present, this vertebra is cervical. Not present, maybe thoracic or lumbar. This is number 1. Fine. I found here a transverse process foramen or foramen transversarium. Yes. I wanted to differentiate the cervical itself vertebrae from each other. We have 7 cervical vertebrae. I wanted to differentiate them from each other. How? Simply look to the spine. If the spine is bifid like that, so this vertebrae from number, this vertebrae named typical cervical vertebrae from C3 until or up to C6. Why? The spine is bifid. Fine. If the spine is not bifid and long, so this vertebrae will be the last cervical vertebra, C7. Okay, now look to the spine. لو الspine is bifid, spine is bifid, divided. So this is typical cervical vertebrae from number C3 up to C6. If the spine is not bifid, not bifid, so this is number 7, C7. Fine. We have also C2 and C1. The C2 is very characteristic like that, have a body, have transverse process, and this transverse process have a foramen and the lamina and with the spine, and the spine is bifid. So it is the same here of the typical. But what is adding? Why it is C2? C2 is named axis vertebra because have a long process arising from the body like that. It is very characteristic for the C2, so it is named axis. This part is named dense. C2, why the C2 is axis? Because it's a body bony projected from it's a body named dense. Right. Why C1 is named atlas or C1? Number one, have no body, no spine. The C1 is very characteristic. No body, no spine. But what else? Superior articular process here, and inferior articular process, and this transverse process, and foramen transversarium, foramen in the transverse process, and uniting together by anterior arch and the posterior arch, like ring shape. This is how simply to differentiate the cervical from thoracic and the lumbar, and also differentiating the cervical vertebrae from each other, like here. Who can identify this vertebrae? First, we look to what first?
Bifid spinous.
No, look
The foramen in the transverse process.
Yes, foramen. If there is a foramen, this is cervical or lumbar or thoracic? Cervical. Number two, look to what?
The spine.
To the spine. The spine here is bifid or no?
Bifid, yes.
Bifid. But this is number?
From 3 to 6.
It is named typical cervical vertebra. From C3 up to C6 type. If the spine is not bifid, like here.
7.
Last cervical. This is last. It is long spine and not bifid. It is C7. It is very easy. طيب نشوف كده اللي بعدها. This one have body, صح? Have body.
Yes.
Have a spine, and the spine is bifid, and this is a lamina. This is a transverse process. Superior articular, the same of the vertebra. But what here? The most characteristic feature. This is a dense, or have another name, odontoid process. Or the dense. This is projecting from the body. So what is the name of this vertebra? C2. Or axis.
Yes.
Fine. So look to here. Look at here.
No spine or nobody.
أول حاجة nobody here, no spine. Superior articular and from below inferior articular. Transverse process with a foramen. And all these are united together by arch. This is the small one is anterior arch, and this is a posterior arch. This is a ring shape. So what is the name of this vertebra? C1 or
Atlas.
Even now we identified the cervical vertebrae, the 7 cervical vertebrae from each other. What else? Thoracic vertebra. Why this vertebra is thoracic? Number one, look at what?
Ribs place. Or...
No, look at first to transverse process.
Yes.
There is في foramen ولا ما في? There is a foramen or no?
Yes.
Yes.
لو في foramen في الترانسفيرس يبقى this
بتكون
vertebra
cervical يا دكتور.
cervical. طب no foramen
thoracic or
Thoracic.
lumbar.
maybe thoracic or lumbar. I want to differentiate the thoracic from lumbar. The thoracic, due to the attachment of the rib, look to the body from the side. From the side. Body, side. Okay, what happened? You will see this facet or facet. Facet. This is due to the attachment or its articulation with the ribs. This facet like an impression, like a print, due to the attachment of the rib from the side of the body. So if you see this facet, this will be thoracic vertebra. يبقى the thoracic vertebra characterized or identified is by the presence of the costal facet due to attachment with or articulation with the ribs. And also its size is intermediate between the cervical and the lumbar. The lumbar is large or big, and the cervical is small, but the thoracic is a midway in between. Okay. What else? Lumbar. Who can identify the lumbar? Who can say?
First we look in the
Excellent.
body
No.
foramen.
No. Yes.
Transfers process. معلش.
Excellent. To the foramen transverse process. It is yes or no?
No.
No transverse process. So, second step, I look to what?
The costal facet.
No, before the costal facet. Yes, to the body of the costal facet. Costal facet. طيب, yes or no?
No.
لو yes تبقى
thoracic.
thoracic. No.
Lumbar.
Cervical.
No. يا راجل. Lumbar. Costal facet here. No foramen transversarium. يبقى this is cervical or lumbar. No costal facet يبقى this is a lumbar, and the lumbar is large هنا in size. No costal facet. No foramen transversarium. And it is large body, so it is lumbar vertebra. Okay, شباب? Any questions here?
دكتور معلش تكون كلها من L1 ل 5 نفس الشيء.
For you now it is okay.
حتى الثوراسيك صح؟
For you now it's okay, but next blocks إن شاء الله we have to differentiate in between. Okay?
إن شاء الله.
Sacrum, it is a fused sacral vertebrae fused together and forming a foramina in between. So this is the sacrum and the coccyx united together, or sacral 1, sacral 2, sacral 3, 4, and 5. This is the coccyx, and all these are united together to form the sacrum and the coccyx. What else? I wanted to connecting this vertebrae together. Why? This is important for us to make the vertebra as a one unit, because we have 33 vertebrae. So we want to connect it by a ligament. A ligament. Fine. What is the name of this ligament? This is a body of one vertebra, and this is a body of another vertebra, and a body, and so on. This is the spine. This is the spine. This is the spine. This is the lamina. This is the lamina. This is the lamina. Okay? Fine. I wanted to connect this vertebra together. Number one, I want to connect the body together from anterior. So the body are connecting by this ligament from anterior, and this ligament is named anterior longitudinal ligament. So this ligament which connects the body anteriorly together named anterior longitudinal ligament. Fine. If I connected the body from the posterior together like that, what is the name of this ligament? Posterior longitudinal ligament. يبقى هنا longitudinal ligament means the ligament which connecting the body anteriorly by anterior ligament and posteriorly by the posterior ligament. طيب. If I wanted to connect the spine from its tip together, so this ligament will be supraspinous ligament. Supraspinous ligament here. What means by هنا connecting the tip of the spine together. يعني حرف نهاية اللي هو end of the spine together. If you want to connect the spine from the inner surface here like that, like this ligament, so this ligament is named interspinous ligament. First, we will connect the body anterior longitudinal, and posteriorly by posterior longitudinal, spine together, supraspinous from the tip, and from the inner surface of the spine is named interspinous. And finally here, you will find the lamina connecting to the lamina below, lamina to the lamina below. So this ligament which is connecting the lamina, named ligamentum flavum or interlaminar ligament. Interlaminar ligament or ligamentum flavum. Very important. Ligamentum flavum. Ligamentum flavum connecting the lamina together. Okay. Okay. Atlanto-axial joint. Atlanto-axial joint. What means by Atlanto-axial joint? What means by Atlanto?
C1.
Yes.
C1
C1.
C1
طب axial.
C2.
C2
طيب. Median. What means by median?
between
Median in the middle. Median at the midline. So here we make a joint between what? Between the dens اللي هو الأودونتويد and between the arch اللي هو الانتيريور arch of atlas أو between the dens. This is a dens اللي هو process from the body of C2 unite with the anterior arch of the atlas. This is the anterior arch of atlas. So this joint named median atlanto-axial joint, and its type is synovial pivot. Synovial pivot. Synovial, هنا we took it before in foundation. It is the rotation. It is the movement of the joint. Synovial pivot. What means by atlanto-occipital joint? What means by Atlanto?
C1 also.
C1
طب occipital here it is a two bone projecting from the skull downward. It is named occipital. The name of the bone of the back of the skull. Occipital condyle on each side of the foramen magnum. So the occipital condyle unite with the superior articular process of the C1, forming the atlanto-occipital joint, and this joint is named, what is the type? Synovial condyle. Synovial condyle. But we have here two joints in the neck. One joint, the atlas with the axis in the midline, it's named median, is a pivot, and it's a movement rotation. And also we have atlanto-occipital joint between the occipital bone and the atlas اللي هو C1, the superior articular of C1, and its هنا joint is synovial condyle.
دكتور
Yes.
الأطلس فيها فست؟
Yes. فيها superior articular. It is named the facet or process. Okay.
اوكي.
هنا يعني the same name. Don't care. Okay. يعني this articular process it is the facet or named يعني some books named it as a facet. If it is confusing for you, you can say that it is superior articular. Okay. This is an X-ray of the skull. X-ray, the type of the X-ray, which هنا normally to the bone structure. This is the occipital bone of the skull. This is the teeth. This is the mandible. This is the vertebrae. This is the odontoid اللي هو الدنس. شايفينه يا شباب؟ شفتوا الدنس؟ Articulating with anterior arch of atlas. This is the median Atlanto-axial joint. This is the spine of the vertebrae. Spine. Okay, this is the median Atlanto-axial joint, which is a synovial pivot. Okay, شباب. This is the ligament which is connecting the axis with atlas with the skull, like an crochet ligament, like the crochet يعني صليب يعني crochet ligament like that عشان يمنع to prevent the disconnection between this vertebra with the skull. Okay, intervertebral disc. What means by the intervertebral disc? The intervertebral disc here is a disc in between the bodies of the vertebra. This is very important to prevent the friction between the vertebra together. This disc is formed of what? Formed of two parts. One part is in the middle, like here. It is named nucleus pulposus. Nucleus pulposus. Nucleus يعني in the center, and the pulposus it is a jelly material which contain about 80% water. And one outer like that, the structure outer of the disc like that, it is named annulus fibrosus, like fried egg. The center of the fried egg named the nucleus pulposus, and the outer of the fried egg it is white in color, so it is named annulus. Annulus يعني ring shape. Fibrosus يعني white in color, fibrous tissue. It is formed of collagen fiber and fibrous tissue. What is the function of the disc in between the vertebra? Number one, shock absorber or absorption of the shock, and also prevent the friction between the vertebrae. Okay. During aging or aging process, due to the old age, the water content here of the disc will be decreased. The disc here will be thinner and also less elastic. And all these factors will lead to bone-to-bone friction. And what happened? Osteoarthritis. Osteoarthritis يعني خشونة في العظم. Osteoarthritis. Again, the intervertebral disc formed of two parts. One outer it is named annulus fibrosus, and one inner is named nucleus pulposus. And the aging, the water content and the elasticity and the disc will be thinner, so bone-to-bone friction. Okay. What is the curves of the vertebral column? I told you in the DR before that the baby will born its vertebral column like that. It is convex from posterior. Again, شباب, convex from posterior and concave from anterior. العكس. ده البيبي during هنا during after birth. What happened? At the 3 months of age, the baby will prune and raise her head up. 3rd month. So what happened? The baby or the newborn, this curve is named primary curve. What means by primary? يعني dating birth, or he was born like that, his vertebral column. But at the 3rd month, Due to the baby's head like that, if you put the baby on his abdomen, on the bed, so he will raise his head up. What happened? Will make a curve in the neck. This curve will be named secondary curve. It's changing the curve from the primary to become secondary. What means the here in the neck, convex posterior, so it is will be convex anterior. So it is named secondary curve. If a secondary curve, the cervical curve will be secondary curve. What means by secondary? Due to the raising with the baby's head after birth. What means convex forward or anterior? When at the 3rd month. So the cervical curve now is a secondary curve. Okay. What else? The thoracic curve not changing. Convex posterior remain primary or kyphotic. Primary curve, the thoracic curve, convex posterior or named kyphotic curve. And it's concave from forward. Okay, the primary curve, the thoracic is a primary, not changing after birth. Remain like that. Convex posterior and the concave from the anterior. And the thoracic curve named kyphotic. Kyphotic. All of us born as primary curve or kyphotic curve. Okay, what else? Lumbar curve. What happened to the lumbar curve? Even the cervical curve is secondary. Thoracic curve will be convex posterior like that, primary. The lumbar curve at the age of the 9 months or 1 year or after that, the baby started to walk and stand upright. So the lumbar curve will changing to become secondary. What means by secondary? Convex from anterior like that. Like the cervical curve. The secondary cervical curve is secondary. Thoracic curve is primary because not changing. Secondary curve will be changing due to the walking and standing up. So it is named also secondary, the lumbar curve. The primary curve of the thoracic it is named kyphotic. The secondary curve of the lumbar is named lordotic. Lord from the general, like a police officer, which is pushing his abdomen like front. So it is named lordotic curve. Lordotic زي العسكري كده هو مطلع بطنه لقدام فبنسميه lordotic curve convex anterior. ده بيبقى convex from anterior or forward. More marked in female يعني بنلاقيها اكتر في الفيميل. And appears at the age of 9 months. 9 months. طيب تعال نشوف بقى sacral curve. The sacral curve will remain primary convex from posterior. يبقى primary. يبقى it is very very easy. Starting from the cervical. Secondary, primary, secondary, primary. The secondary will be convex anterior secondary. But the primary here is convex from posterior. Posterior. Any question here, شباب؟
دكتور معلش بس ليش more market in the female؟
more market
السبب يعني
بنلاقيها ماركت في الفيميل اكتر من هالسبب ممكن تكون جينيتك and also more market in pregnant حتى بتلاقي البريجننت بطنها طالعه لقدام اكتر نتيجه الايه هم اصلا هي طالعه فالبريجننسي بيخليها more projecting forward اوكي حتى بيسموا اللامبر كيرف ان فيميل بيسموه بريجناتيك كيرف جاي from pregnancy اوكي
ان شاء الله يعطيك العافيه.
يبقى هنا secondary primary secondary primary convex anterior convex posterior هنا convex anterior هنا convex posterior very simply and very easy. We have many abnormalities regarding this issue like if the curve of the thoracic will be more backward more than normal so will be abnormality. So the kyphotic will be more exaggerated, yani increased more posteriorly in the thoracic region. So it is named, this case is named kyphosis. Kyphosis, it is an abnormality due to the curvature of the thoracic will be increased more posteriorly and maybe due to old age or maybe due osteoporosis. Osteoporosis يعني هشاشة بالعظام. Osteoporosis. طيب. If the abdomen will be increasing more like that, the curve of the abdominal where the secondary curve is more increasing up anterior, which is more common in pregnant. So it is named lordosis. Lordosis. Exaggerated mean increasing more. Lordotic curve اللي هو في lumbar region more. It is هنا named lordosis. طيب. The third abnormality here is named scoliosis. Scoliosis here from the school. And what happened to the school? If you are making a heavy back on your one side, so you will walking like a lateral curve, معوج كده في الجنب، فبنسميها it is scoliosis here named a lateral curvature of the vertebral column like that. The vertebral column it is deviated laterally. Due to unequal growth of the vertebra، يعني الفرتبرا نفسها فيها حته عاليه اكتر من الثانيه نتيجه الجروث more in one side. And also this is among female more. Among female with more common in female. So we having more abnormalities in the abnormalities of the vertebrae. Number one, if the thoracic curve more هنا backward, this is named kyphosis. In the abdomen anteriorly like that, it is named lordosis. Or the curve is laterally like that, it is named lordosis. Lordosis means curve of the vertebra laterally. Lordosis means the curve more anteriorly in the lumbar, and the kyphosis more in backward curve in the thoracic region. All this abnormality may be also congenital. What means by congenital? يعني dating birth. Okay. Mostly of these abnormalities are congenital. Any question شباب؟
دكتور
Yes.
ما فهمت انا وش يعني برايمري وسكندري برايمري.
Okay. You didn't get it. Okay. What means by primary? لو هو كلنا بنتولد بالكيرف عامل كده. Okay.
اوكي.
يعني ايه عامل كده؟ like that. يعني كونفكس من ورا من الباك، يعني محدب، ومن الامام بيبقى مقعر كونكيف. اوكي. لو احنا مولودين كده كلنا بنسميه برايمري يعني احنا مولودين كده ما اتغيرش. بتيجي عوامل اخرى بعد الولاده زي عند الشهر الثالث، بتيجي انت بتقعد الولد بينام على بطنه ويرفع راسه لفوق، فيبدا الكيرف بتاع الرقبه ده يتغير، بدل ما هو كان كونفكس لورا بقى كونفكس لقدام. بقى كونفكس ناحيه الايه؟ ناحيه الامام.
يعني دكتور اي شيء بوستيريوري كونفكس يعتبر برايمري.
الله عليك. يبقى هنا في الثوركس او كونفكس بوستيريور يبقى برايمري. السكرم كونفكس بوستيريور يبقى برايمري. لو اتعكس بقى الكونفكس انتيريور يبقى بنسميه سكندري. لو في النك بنسميه سيرفيكال، لو في اللمبر بنسميه لمبر. اوكي. هنا بيظهر عند الشهر الثالث، هنا بيظهر عند الشهر التاسع. هنا نتيجه اللي هو بيرفع راسه لفوق، هنا نتيجه اللي هو بيبدا ايه؟ يتحرك ويقف وكده. فهمتني؟
اي واضح دكتور.
اي سؤال يا شباب؟
دكتور هل يمكن ان الطفل يولد ب abnormal shape rather than
Yes,
primary؟
I told you that هنا ممكن يتولد عنده كايفوزس، عنده لوردوزس، عنده سكوليوزس، دي نتيجه اللي فيه congenital anomalies in the structure of the vertebra itself. بنسميها congenital kyphosis او congenital lordosis and so on.
طيب ما راح نقدر نعدلها مثلا؟
Maybe most of the surgery now بتعمل عمليات اللي هي بتعمل changing the shape. كان في واحده من ضمن البرنسس بتاعت انجلاند كان عندها مشكله في اللاترال كيرف اي ثينك او حاجه زي كده، وعملوا لها عمليه ومش باينه بقت كويسه جدا. زي سكوليوزس مثلا.
دكتور
يس.
الحين إذا انكسر في الفرتبرال كولوم ما راح يصير له أكيور أبدا نهائيا، صح؟
according to محدش قال كده، يعني حتى لو حصل فيه فراكشر في الفرتبري ممكن بالفيكسيشن باي بليت اند سترو، يعني بيثبتوها عادي تبقى كويسه.
بس هو يعني ده يعتمد على حسب المنطقة، صح؟
يس، على حسب الاكسيدنت وعلى حسب المنطقه وعلى حسب
لأنه كل منطقة ممكن يصير لها شلل، صح؟ بارالايز.
هو كلمه بارالايزد مش عشان الفرتبرال كولم، هو حصل هنا، حصل باراليسيس او ايدي ليجن دي نتيجه الباراليسيس اور انجري اوف ذا نيرفز لايك سباينال كورد انسايد، صح؟ السباينال كورد ماشي انسايد ذا فيرتبرال كولم. سو اني فراكشر هنا will affect على السباينال كورد، ممكن يؤدي الى paralysis according to the site of the lesion.
يعطيك العافية يا دكتور.
اي سؤال؟ شكرا شباب جزيلا، حياكم الله.
يعطيك العافيه دكتور.
شكرا.